Hi, we had discussed about phobias in an earlier episode. Phobias are anxiety for a specific object, situation, or activity and actively avoiding them. In this episode, let us discuss about how to deal with these phobias. Welcome to Mindscape Matters, a channel to discuss mental health and more. I am Dr. Mohan Raj. I am a consultant psychiatrist based in Chennai, and I'll be your guide as we explore this wonderful landscape. In addition to treating the anxiety, the best treatment for phobia would be exposure to whatever the person is afraid of. For example, if somebody is afraid or has phobia for dogs, the treatment should include exposure to dogs. Or if somebody has phobia to get into a lift, the treatment would include exposure to traveling in the lift. Now, how do we do this? Because the person would be extremely anxious that they will not want to do the exposure first. So initially, we bring down the anxiety with the help of relaxation exercises, or if the anxiety is severe, we use medicines. There are a range of relaxation exercises like yoga, muscular relaxation, progressive muscular relaxation, breathing exercises, about which we'll talk in detail in a different episode. Suppose a person has phobia for getting into swimming pool. Even if I give him 10 medicines or spend 100 hours doing psychotherapy, nothing is going to happen. Things will start happening only when the person says, let me get into that water and see what happens. Until then, all therapy will be only theory. When somebody has fear of getting into the swimming pool, what people usually do is they talk to them nicely and suddenly, unexpectedly push them into the water. This can have two outcomes. One is the person might say, wow, it's so nice in the water. I don't know why I was afraid all along. But this will be a very small number. Most often the response will be the person who's pushed into the water would panic, and it's likely that they will never come near a swimming pool in the near future. The correct way to exposure is graded exposure. Sudden exposure is called implosion, and it's normally not advised by us because some people can even have cardiac arrest when they are exposed to sudden immense threat. But nature gives us implosion from time to time. When the Chennai floods happened, one of my patients who was normal till that time had flooding in her house. And from that day, she has fear of rain, phobia for large amount of water. Whenever there is a thunder, her anxiety goes up. Though they have shifted to another house which is unlikely to get flooded. The same flood, there was another grand old lady, a patient of mine, who had multiple anxieties, also had flooding in her house. After the flood was over, most of her other anxieties came down. She came to me proudly and said, the water in my house was above the switches. I've handled that. Now why should I worry about other small things? So implosion can work both ways, but as a therapy we don't advise. Graded exposure is exposure in a graded fashion to the anxiety-provoking object, situation or activity in small increments. Let me illustrate. If you go to a swimming pool, when children are just starting to learn, what do we see? Most children are happy to get into the water. There could be one or two children who are afraid to get into the water. They will hold on to their parents' arms and they scream if they are forced to. Now the swimming coach comes to them and says, oh, you don't have to get into water. You can just sit here and watch what others do. And the child sits on a bench with one of the parents and is watching what the children are doing. Half an hour later, the coach comes and says, do you want to sit near the edge of the pool so that you can put your leg in the water? The child will say no, or the child might look at the mother and say, can I? And the coach says, yes, mother can also come. So the child goes to the tip of the pool, puts its leg gingerly, all the while holding on to the mother's hand, Gradually, the child likes the feel of the water, keeps playing. The coach doesn't come back that day. The child goes back. The next day, as soon as they come, the child goes to the edge of the pool, starts playing with her leg, while it's not very particular about mother or father being close by. 10 minutes later, the coach comes and says, do you want to come where the other children are? Other children are in the kids' pool where even when they sit, the level is only up to their abdomen. The child might reluctantly say yes. Amma should also come. The coach say no, Amma cannot come there. It's only for children. So the child goes there. Water is only this much and the child likes the feel of water, likes the company of other children. Maybe the whole day is spent there. Third day, they start with this and the coach might take them to a little deeper side. This is graded exposure. Initially, to only the extent where the child can tolerate, and then gradually take it to more and more anxiety-provoking situation. The same principle of graded exposure can be applied in various phobia. By the by, the jargon for graded exposure is systemic desensitization, a phrase which was borrowed from treatment for allergy. Now, we'll take another example. If somebody has phobia for lifts, that they don't want to get into the lift even with company, the first step would be treating their anxiety, and in exposure, the first step would be somebody travels with them in the lift up and down few times until they are no more anxious about going in the lift with the person. After that is over, the next step would be to say, can you get into the lift in ground alone and get out in first floor? Don't worry, we'll be there. Somebody will be in the ground, somebody will be in the first floor. We will take care, even if it stops somewhere, we will take care. And prepare the person to take the lift one floor. And then gradually increase the number of floors while making sure somebody is in one floor and somebody is in the floor where the person is reaching. Once the person is comfortable, not anxious about going alone for few floors, then we tell them next stage is, we will be there only in one door. You go up say 4 floors, open it, then go back again and come down. This is graded exposure for somebody who has fear of lift. Sounds easy, but people who have phobia take at least 4-5 days to reach this. The next example is agoraphobia, fear of open spaces, where the person is homebound because they have fear and phobia for going out to even buy something. Here what we do is we train one of the family members as a co-therapist and tell them to take the person, go take a bus, train, and go to a shopping place and buy something. After few times and the person's anxiety to travel with the family member comes down, we tell the family member, the co-therapist, to leave the person for the last say 20 meters. That the person will stand somewhere, the person with agoraphobia will have to walk 20 to 30 meters to buy something or do something, come back with the full knowledge my family member is always there and I can come back. Gradually increase the length between them by say 50 meters, 100 meters, 200 meters, so that this person knows somebody is there, I need to just go 200 meters, buy something and come. This is graded exposure. Then gradually make them travel alone. Now, the confidence comes from the exposure that I am able to do something which I thought I will never do. The same principle of graded exposure can be applied to phobias for any object, situation and activity. In today's example, we were looking at specific phobias. There is only one phobia they have. There are people who can have multiple phobias. Like for example, in social phobia, they could have phobia for multiple social situations. We will see how we can handle those in our next episode, where we discuss graded exposure for people with fear of public speaking. Thank you for watching this video. If you like this video, please tell 4 of your friends. Tell them there is a Tamil version also. Stay tuned because Mindscape matters. Bye.